life's greatest questions seem like a mystery? Well, we're probably going to talk about it here at Appalachian Liturgy. Important questions like, are you a Jedi or an Imperial? Is oatmeal actually a breakfast cereal? Is a Catholic weekday really called a ferial? Did you know that Mr. Rogers was Presbyterial? So join us as we have a little fun talking about thy kingdom come. Appalachian Liturgy.
Okay, welcome everyone to the Appalachian Liturgy podcast. I am Justin Stacy.
I'm the Reverend Brooke Ashley.
And I'm Justin Bowling.
And tonight we have a reoccurring guest, Dr. Daniel Lewis. He is a doctor in sports family medicine and CEO of Ballard Facilities in the Greenville area. Welcome back, Dr. Lewis.
Hey guys, thanks for having me.
No problem. So last year, you were actually our first guest last year, and it was before we really decided what type of show we're going to be. So you and I did like a one-on-one interview at the end of that podcast. And then we decided, you know what? We don't like that. We don't like that format. So we're going to have our guests, with all of us so that we can have a panel discussion. So okay. I guess you helped change our podcast.
Saying I ruined the first one so bad that you had to go back to it, right?
No, I think what it was, honestly, is I think Brooke and Bowling was like, you know what? We felt left out. Like we didn't get to talk to this guy at all.
Exactly.
It was my own fault, really.
No, we made it a year after that first podcast. We figured if we brought you on again, that may give us.
That's right.
Year. There we go.
Yeah,
if the and changes completely. I'm gonna have a complex after this, so you know.
Yeah, but I just to note, I'm going to leave the first interview that we did in the show notes. So anybody that wants to go back and listen to that can. But I'm going to turn the floor over to you, Daniel. And we like to give our guests just a few minutes to kind of give your Christian witness, your testimony. So if you don't mind.
Absolutely. Well, and so I appreciate the opportunity to be here, and always appreciate the opportunity to talk about my faith and what God has meant to me. I guess my Christian, testimony is relatively benign. I grew up in church from my grandmother took me to church from the time I was 3 years old. My parents were not in church. My grandmother made sure I made it to church routinely. I was saved at the age of 14, realized I was a sinner and asked God into my life, and he was gracious enough to do that. So not a lot of sordid tales to come from before or after. So I've been a Christian for 2/3 of my life at this point now. But always probably my walk has not always been reflective of what it always should be. At times it's easy to get my priorities out of line, and between work and family and God and trying to get those things out of balance. And so I struggle some with that. I've been actively involved, I say, in the church, various churches for a while. We attend First Baptist Church here in Greenville, Tennessee. We taught Sunday school class there for about 10 years. Stepped away a couple of years ago to help a mission, kind of a mission church, West Hills Baptist Church, kind of a replant in the Jonesboro, Tennessee area for about 3 or 4 years. And now I find ourselves transitioning back to First and being active with the Sunday school class again there and things. But, really, this last year, I think, has brought me closer to God. God used my COVID experience we talked about a lot, I think, for various reasons. Potentially to use me as a voice for others to get some information out. But I tell people more, first and foremost, his primary need is probably to get my attention and get my hold more than anybody else's, and to make me realize that he indeed is what I need to focus on and be my primary focus, not my work. And I need to balance my family and my involvement with church with them as well. Again, so, priorities can sometimes get busy. You mean blessedly, don't want that title, but it's easy to get wrapped up in the day-to-day work and to be busy there and have a lot going on. Just God's been very good to me and my family. He's seen us through this COVID pandemic and through many other trials and tribulations. And I just want to reflect him in all that I do and make sure that people know that there's nothing that I'm bringing to the table that he hasn't brought to me. So I'm thankful for that. And again, just very blessed to be here and have the opportunity to speak to you all tonight.
Amen. Bowling and Brooke, since you all didn't get the opportunity to really ask anything before, how about you all kick us off? Any questions you have?
So Daniel, as a pastor, one of the pushbacks that I have really gotten when talking with people about vaccination or wearing masks or social distancing is a real pushback about having faith over fear. And I mean, I have some theological things about that, feelings about that. But how, as a physician and as a Christ follower, how do you answer people who are right now kind of saying, I ain't scared of this. God's got me. What'll be will be. How do you answer that?
Yeah, that is, I think that's a difficult question to answer, and it's hard to debate that sometimes. I have, you know, in the church bodies I've been part of, I've seen them struggle with those questions and back and forth. You know, I now have several of my church members hospitalized in my hospital with COVID right now, having to deal with this as well. You know, God certainly gives us a free will to follow and to do those things. And I certainly felt my faith was strong now that I was diagnosed with COVID and everything else. I also feel like God gives us opportunities and and a witness and a mind to share His love in ways outside of a church room or church building per se. Also, you know, and He also, I think, gives us a mind to and gives us tools to use. You know, I harken back. I tell some folks that, you know, that kind of heard the old parable, the joke about the man drowning in a flood and sitting on a roof, and you know, two people come by to rescue him, and he says, "No, God's going to take care of me." And third person comes by, God will take care of me, and he ultimately drowns and he gets to heaven. So I thought you'd take care of me. He said, I sent you 3 boats. You know, I feel like
I love that. Yeah.
That's what we've had in this situation too, is that God's given us tools to deal with and to modify the risk here. I agree that God wants us to be together. God also says when 2 or 3 together in His name, we can worship together. So it doesn't require a congregation of 100 or 500 or 50 to do so. And so, you know, we have the technology now to be able to meet asynchronously or meet via Zoom and other methods. I think you can still worship and still employ your faith, be mindful and be smart about the situation we find ourselves in. And I think God gives us that ability to discern that and to look towards that. In other countries where we don't have the same degree of freedom, of religious freedom, you don't see folks gathering in mass like this, and not in defiance, but in large areas, and yet they can still be the church and still worship together. And so I just feel like we prioritize our individual freedom somewhat over what the good of the society and the church is. And God wants us to take care of our communities as well. That was part of the first purpose in Acts, is take care of the widows and the the children, and to take care of those around them, not just them inside the building. So I think we could do a better job being a witness to those around us at times.
So yeah, I love your answer. You know, I think as a pastor, one of the hardest things too through this pandemic has the inability to do the things that we would normally do to comfort one another. And that's been difficult. You know, I had a conversation just today with somebody about how I'm willing to do whatever we need to do to keep from having to go on a complete lockdown again. Like whatever we need to do, whatever I can do to keep from having to walk with people through death because of COVID, I'm willing to do that. And my hope would be that others would be the same. So
Yeah, I wanted to say too. You talked about your testimony as being a benign story, but I think we maybe even talked about on this podcast before that I think we need more, benign stories. I think people sometimes feel ashamed if their, conversion story or walk with Christ isn't, a road to Damascus moment or something like that. But just that everyday highs and lows of the Christian life is sometimes can be discouraging. So I think more stories like that's great, so that people know that's the norm, and not to be discouraged when. That's how it works. But I guess mine's kind of a similar type question as what Brooke was going for. And it's, do you think that there's something either, maybe as a church or just in general that we could have done to help with messaging on some of this? Because I feel like, especially with like how people understand science in general, that when guidelines change or, how far apart we need to be changes or something like that, people will take that and say, well, they don't know what they're talking about. Clearly they said this one week and said this the next week or something like that. How can we have, is there anything you think we could have done to kind of better get across that, what that is?
I've struggled with that a lot because it has been hard. And what I've seen some incredibly supportive pastors and, some pastors that really do a good job, and others that, to be frank, I've been disappointed in their stance. And, Jesus said in the Bible, rendering to Caesar that which is Caesar's. He told us to obey the laws and obey the government and essentially to cede to them in the matters that were important. Now, not in our Christian lives, not everything is the first to Christ, but some of the stances have been taking about masking, about wearing a simple piece of fabric over your face, and and that I don't see Christ being opposed to that. I think Christ would have been the first to take a vaccine if it had been available to protect others around him too. So I've been disappointed in the church. I feel like not necessarily modeling what I would say was Christian behavior at times. And I say the church as a whole. Again, there are outstanding examples that have done it well, but but not modeling the behaviors that Christ would have modeled. To defer to the local authorities, not in a way that's negative, or not to say that he was uninformed, but yet to defer to what was theirs and to give them their space. And and I do think people really struggle with science. And my wife is an educator, and she jokes that this is the illustration of the failure of the education system. No one understands the scientific method. I mean, when the CDC didn't, quote, change their mind, information came out that appeared that it was clear that the viral load for the Delta variant in particular is 200 times out of the other. It's easier to get contaminated with it. The antibodies that are built don't come out in your secretions, so it can live in your nasopharynx and it can be passed on, even if you're not sick, which is why they now recommend vaccinated folks to wear masks. But masking and the vaccine in general has become such a political football in this country, and some of our political leaders have done such a job of painting us against each other as well. A focus on the collective good versus individual freedom is what we need.
I'm so excited that you talked about the scientific method, because that's one of the conversations I've been having with people is that, most of us learned the scientific method in the 5th grade when we did science fair projects, whether you're testing the life of a battery or what Coke does to a tooth or whatever, and that's, how you have a problem, you make a hypothesis, you test the hypothesis, and you reject or confirm the hypothesis. And we've been seeing the scientific method lived out in real time for us. And instead of this idea of I've gotten more knowledge, therefore I'm making adjustments to recommendations, somehow we've jumped to, well, they were all farce to begin with, and
social media and things have advanced to such a point that all this happens in real time. It's been 30 years ago, there have been an article came out, and then 6 months later, when someone publishes the new article, we would say, oh, well, now there's new information. Well, we're watching what happens the 6 months in between. We can see it happening, and it's publicized all over the world within minutes. And so, yes. And then I say, I think we in the society have gotten to this extreme of good versus evil, or bad versus good, or whatever line you want to draw, Republican versus Democrat, what have you. And and demonizing individuals for their one stance versus looking at them as a whole person.
I'm glad you brought up social media, because that was going to be my next question. Just in the last week or so, there have been some very popular social media posts of different medical and posted by friends of mine that are in the medical profession about the fact that, it's truly the people who are vaccinated that are spreading the mutation, that's the reason. And I mean, just, I'm shocked at the people who are sharing this type of information. I feel like, they're the people who are on the front lines who are seeing this stuff. I wondered how it personally makes you feel when your colleagues or folks that I would consider your colleagues share disinformation.
Yeah, no softballs tonight, huh? No, absolutely. My personal belief is they probably should be brought up before their individual licensing boards by the states and sanctioned or censured, whether it's the medical board, nursing board, or whatever. To share patently false information or information that's been disproven or what have you. Listen, we can all have opinions, and I'm good at that. And my opinion on COVID is not the be all end all at all. I'm sure there are lots of other, information there, but I have colleagues that think ivermectin is a treatment of option. I personally, based on science, don't believe that it is. Most of the scientific literature doesn't support it. That doesn't mean there can't be some out there. But, by and large, 96% of doctors are vaccinated in this country. 96% of us don't agree on anything. You put us in a room together and say the sky is blue, and I guarantee you 10 of us at least will say it's a different shade. by and large it is. But again, social media kind of gets that voice to everyone, and everyone can have that ability. And then I feel like we've not done a good job of engaging those on the other side with compassion and things on either direction. And so those that are unvaccinated are feeling undue pressure that they are, some people are making them feel like they're the cause of this and they're the issue. So when they see something that says, "Oh, but a vaccinated person can carry it too," if they were never vaccinated and everybody mutated, then they're going to spread that just for their own self-reliance and for feeling better about themselves. But to blatantly answer it with misinformation or things, is just that's my concern. Is they're actively dissuading others or spreading information that's not true, which then discourages others. This show was a golf instructor, and I said, if you tell somebody how to swing a golf club and they choose not to follow your approach, you probably think that's not best for them for their golf game, but that's okay. But if they go out and tell you another PGA professional told them they'd do better if they had a boat oar and swung it like a bat, you'd think they was crazy, and would you really be proud of, would you be able to sign off on that? And he's like, "No, I get it." So, I don't mind people having questions about the vaccine or about the treatment or things at all and approaching those open-minded. What I do mind is when people say they want to approach it open-minded, but yet when you get them the information they ask for, they just change it to another straw man argument, and it goes around in this circular fashion. I'm losing my patience for that.
Yeah, and I think the pandemic has really magnified that. I mean, I think that was happening in all arenas as well, and no matter what the conversation. But I feel like the pandemic has just kind of magnified that, and people have kind of staunchly gone to their corners, if you will.
Absolutely.
So we've lost what little use of common sense we had seems to be going out the window.
Yeah, it's like you said, social media has made what I've heard called nut picking. It's not cherry picking. You pick out, one nut that exists out of some kind of group. You can always find it in any group, no matter what it is. Like you even think of like some of the commercials from the 70s and 80s. It's like 9 out of 10 dentists agree that this toothpaste is good for you. I mean, we always knew that that's kind of how stuff worked.
There's always
but
one, right?
There's always somebody that disagrees. But
right.
But I'm with you too. I have a hard time personally, struggling to stay compassionate. And when you feel like that there's a difference between somebody who's honestly struggling with something, like having a hard time coming to a decision versus somebody who is doing that, like, I'm going to find whatever's out there to try to justify my opinion. And I'm going to act like I'm open-minded and not really be. I know I still should be compassionate because, number one, that's what Christ calls us to do. And obviously that being the top reason, but even beyond that, like, if our goal is to get more people vaccinated, more people trying to do, masking and stuff like that, we can't just write people off because that doesn't get us anywhere. That just leaves us in the same spot. But it is definitely something to struggle.
And we're seeing that in the hospitals too now. I mean, with the 88 to 95, depending on which day you look at it, percent of patients in the hospital are unvaccinated. And nearly all of them in the ICU are on ventilators are unvaccinated. The few that are vaccinated and ventilated are typically in their 80s with some sort of comorbid condition like a cancer or something else. It is hard, and the healthcare workers in general are in short supply and they're tired. And then, last year when I went through this, I didn't do anything to put me at risk, or I had no method of protection. I wasn't aware at the time what was going to happen. I was one of the first 10 cases in Greene County. We weren't wearing masks then. Nobody thought about it. But now to see it happening again, it really does stress people's compassion. And I've had, providers that work with me or for me that people have told me some of the things they said. And I'm like, oh my goodness, we can't say that and we can't do that. But I know where you're coming from. And I understand why you want to, but you can't.
I think that there's a mental health component. And of course, this is just from a pastoral standpoint that we've not talked a lot about as a culture. And I call it COVID fatigue, that everything's changed so quickly, so fast. I mean, the way we did everything changed, and that causes stress in us. Some of us handle that better than others, but we're now going on 18 months of this. And I think we are all tired. I mean, I know as a pastor, I'm exhausted in caring for folks and in having these conversations and trying to find creative ways to offer spiritual health and wellness to folks. I can only imagine what that is like on the medical front. But I think everybody's being affected by that. And I don't know that we're talking about that a whole lot. but maybe we should be. Maybe we name it so that we know, hey, I'm really having a bad day with this, and take a break. But it's hard, and pastors are notorious for being the worst when it comes to self-care. So I am not throwing stones at people.
Pastors and doctors and nurses, yeah, absolutely. We all need a big spa day after this is over, but it really is. It's very hard to maintain that, that sometimes those feelings that come across as lack of compassion, but for me, it's often sorrow because I see somebody that's diagnosed, and I'm like, you could have done. If I just could have got through to you,
Right.
you didn't have to be here. You don't have to be laying in that bed like I was. You can do something that can make you much better. And yes, our treatments have improved and everything else, but you didn't have to do this. We could be in a different place at this right now. And that's the hard part.
So I had one question for my wife. She's an RN as well. She actually used to travel to do education out to probably your neck of the woods a little bit. For nurses, but she wanted me to ask, just like your guess, obviously you can't tell the future, but do you think that we're looking at any relatively, in the relatively near future, any new variants other than the Delta ones that's going to kind of overtake it, or are we going to kind of be more, endemic in it and recurring?
It's hard to say. The virus is certainly, it's certainly mutating quickly. It's mutating quickly because it has the ability to spread so much because we don't have the vaccinated population per se. If it's in a room with 10 people and 9 of them are vaccinated, it would just die off, right? Because there's no one else to go to. But that's not happening. I can't predict the future. My guess is probably, we saw a decent spike of the alpha variant. Beta didn't really do much to us because we still had people that had natural immunity or antibodies from it coupled with the beginning of the vaccination. I hope, I guess, is that the Delta variant is so contagious, spreads so quickly. We're going to see, and we are seeing huge numbers of people infected currently. It'll hopefully burn off all the tinder and the wildfire will die out pretty quickly. It's going to get intense quickly, but hopefully also die down quickly. Whereas before it's a 3 to 4 month launch, we're anticipating high numbers in the next 2 weeks. But after that, you see Missouri and Arkansas are starting to go back down. So I hope it'll be intense. I am encouraged to hear more and more folks now saying, I went to get my first shot. We're at 38% vaccination in the state. I'm hoping we'll be at 50% when this is all said and done, potentially. And maybe that 50% vaccination rate plus the 30% that will be affected in this short term from that will be enough to keep us out of the next couple of variants. So hope we don't talk about Lambda too much, but what does Kappa or Omega look like? In the spring, we're not sure.
Yeah, hopefully. I like the idea.
Viruses typically mutate to become more contagious and less virulent, though. Viruses don't benefit from killing off their host because they die. That makes sense.
Yeah, I never knew that. That's interesting.
So what's happening is we are seeing it become more contagious, as you think. And in general, if you're healthy now, as long as we can provide care, we can typically get you through. There may be significant. I'm not saying it's a walk, and a lot of people say, it's not going to kill you. Why does it matter? On walking testimony, well, it didn't kill me, but it cost me 6 months of my life easily, at least, if not the long-term issues. But if it becomes more contagious and less virulent and doesn't put people in the hospital, then we'll adapt to it. We'll learn to live with it. But it's going to take some more time for that to happen, unfortunately. And hopefully we don't run out of resources while we're waiting for that to happen.
I think that's been one of my struggles talking about resources is getting people to understand how stretched our medical resources are. So if you're not sick with COVID, but you're sick with something else, you're affected because of the number of hospitalizations of COVID. Can you talk a little bit more about that? Explain that for folks.
I can certainly try. So, certainly, and we're in a situation in this area, whatever else, where we have hospitals with beds, but we don't have hospitals with staffed beds. The hospital in Greenville has about 130 beds. I've got about 75 of those staffed at any one point because of staffing. We're 500,000 nurses short across the country right now. There's been a nursing shortage for the last 10 years. It's now hitting communities like our own, where previously it wasn't as big an issue. So we're seeing this influx of decreased number of nursing graduates, increasing nurses pursuing advanced degrees like nurse practitioner degrees. When COVID hit last year, and you had a nurse that was 63, 64 that was close to retiring, they said, au revoir. I'm not going to take a chance on dying in this. I'll see you later. So all those folks left, and we've not gotten all those replaced yet. We then had people delay care because of concerns about COVID, and they put off things. So in general, the general population is sicker. So even in July and August, while we weren't having huge COVID spikes, our typical hospital census, we were about 20% over what we normally were, 25%, because people put off the care from the spring and they'd been worse and came in and were sicker. And we're trying to do all the things and really get their catch up. And so that's still ongoing. And then you see the COVID things happen on top of it, and it becomes very difficult. And so that's really where we are now, is we want people to receive the care that they can. And you're absolutely right. The COVID resources, it's because the PPE and the things required, it's hard to take care of them. You can't assign as many patients per nurse. So, our COVID patients get essentially a 1-to-4 ratio, one nurse every 4 COVID patients. If you're a medical patient, that's a 1-to-6 ratio or a 1-to-7 ratio. So if I have a COVID ward, I automatically lose 30% of my capacity per nurse, because it's just a necessity to make sure we protect them and give them time, to gown up and gown and glove and do those things and make sure that they're all protected. So it does exacerbate the problem greatly. And, and that's really where we are now. Is our concern is certainly the COVID patients, but we're more concerned about, but then you just don't have the bodies available to take care of the heart attacks and the strokes and things as well either. And we see people die from those things or have adverse outcomes from those things, whereas if we weren't overwhelmed, we wouldn't have to put that, they wouldn't be as much at risk.
Yeah, one of the things I've tried to
cardiac right now, because there's not an ICU bed in the area.
Yeah. Well, and I think of my grandson's high risk. He was in the NICU, born severely premature, came home in February, and in April, as a 4-month-old, had appendicitis, and we spent a week in NICU. And I've thought about if at the time the numbers were what they were now, you have a 4-month-old come in, something like appendicitis might be missed because that's not what you're looking for. Like, people had the time to really explore that. So that is a scary thing. But I've been trying to get people to understand, it's like when you go to a restaurant and you're sitting and you have a wait list of 45 minutes to get a table, and you're looking around and there's all these empty tables, right? It's not about the table that you could sit at. It's about how many tables can your waiter or waitress wait on effectively? Right. How quickly can the kitchen get your food out? There's lots more to play than just there's a bed and you go lay in it. Like that's there's more to it.
Absolutely.
Than that.
So I have a question about vaccines. The 2 things that I hear most on social media, mostly about, I guess, vaccine hesitancy is, 1, it hasn't been properly tested, and 2, I have seasonal allergies, so I can't take it. Right. And that's an exaggeration, but people literally come up with every kind of disease possible and say, because I have this, I can't take it. So that's a 2-part question to you. Can you, 1, confirm it has been properly tested? And 2, is there a widespread autoimmune diseases that we should be, hesitant of the vaccine for?
Absolutely. So, yeah, absolutely. I hear that. And kind of a caveat or a corollary to the first question is, people say it was developed too fast to have been properly tested. It came out too quickly. And so I try to tell folks, and this is the way I used to try to spell it out. I said, there's 3 parts to any development of a vaccine or issue. 1, there's kind of the pre-work, there's the clinical trials, and there's the post-work. So the pre-work, and I relate that to opening a restaurant in town, for example. If you're going to open a restaurant in a town, you guys aren't from Greenville, we have a plethora of Mexican restaurants. If I wanted to open another Mexican restaurant in town, I probably want to be very mindful of what we have, where they are, what the market is, what's the space, what can be my return on investment. I wouldn't be very successful if I just went into a store and threw up a Mexican restaurant. Pharmaceutical companies do the same thing. When they put millions of dollars into developing a drug, they want to make sure it's something they can make a return on, right? The federal government short-circuited that completely this time, because they wrote them a check, essentially, to say, here's your money, go make this. So it took all the pre-work out of it. Going back. Now, we had the mRNA technology, and I tell folks that people think mRNA, yes, this is our first mRNA vaccine we use widely, but we've been trying to use mRNA vaccines and mRNA, deliverance for 20 years now, primarily with gene therapy, trying to defeat cancer. The cancer is multifactorial. It's not just one gene. So that's why it hasn't worked for that. But this was beautiful in that it was something we could deliver a protein and deliver a recipe to your cells to make a response to. So we had the tool available. We just had to make the right key. With genetics now, we can get the key and we had it ready available to produce it immediately. The safety trials were done the same as any other drug that comes out or drug that's available to the FDA. They did a small group of 100, 150 people, gave them the shot to make sure they didn't grow a third arm or turn green like the Hulk. They then enrolled, 30 to 50,000 people each for Pfizer and Moderna. All those companies put out a pledge that they would not short circuit that procedure. They didn't. AstraZeneca is one of the ones that signed that. AstraZeneca had a hiccup in their safety trial and had a potential issue that honestly probably was not related to the vaccine, but it was enough to derail the entire process. We still don't have an AstraZeneca vaccine today. It never came out. That tells me the process worked, right? It never came out in this country. They did the 30 to 50,000 people for the 3 to 4 months. They measured, they saw amazing antibody production, amazing responses, and to the point that where the data was just hard and fast. They cut off a couple of trials because they had 1,800 people back, in a study, and 4 of the vaccinated got COVID versus 400 of the others. It just was striking, huge differences. But then the other part that was done was, remember, the government wrote the check in the first step. So Pfizer and Moderna was able to produce this the entire time. So they were making the supply of the vaccine to have it readily available. And we did short circuit the FDA and say we want to do an emergency use authorization. It's not been fully FDA approved yet. That's the other point I hear people say is, let's not FDA approved yet. The application's in the FDA's hands. I almost guarantee it'll be approved by end of September, in October. The safety trials were the same as any other drug or any other thing that's out there. Your blood pressure medicine, your diabetes medicines, we did the trials the same. After that, we now have, 100 million people in this country vaccinated over the last 6 to 9 months. We've got the hugest post-exposure study trial ever put together with this vaccine, and we're not seeing large issues at all. Mm-hmm. There have been some reported deaths related, that people assume are related to the vaccine. They are not huge numbers at all. There was the small increased risk of thrombosis with Johnson & Johnson vaccine. That was paused, and there were some guidance given about, individuals, females in particular of childbearing age, that maybe could increase their risk of blood clots, cavernous venous thrombosis. But the mRNA vaccines have proven to be remarkably safe. I'm now 8 months past my vaccine. People in the trials are now a year past their vaccine. I still don't have my third arm. I'm still not green. I did go bald, but that was already happening before the vaccine, I promise. We've got the largest probably study of vaccine. And the other thing I'd reassure folks is, given this now, in our history, we're yet to find a significant problem with the vaccine 6 months after its development. Every issue that's ever been related to the vaccine has occurred within 6 months of its development. This was developed in April of 2020 at this point. We're now 16 months past the development of the vaccine. There's not going to be a switch flip tomorrow that makes people at risk. Some folks with autoimmune diseases and some of those things that have concerns about vaccines and things, I do understand the hesitancy. I always advise you should talk to your doctor about that. But I will say this, there is not a risk related to the vaccine yet that I found that's not on a factor probably 100 times greater to be more complicated with COVID than with the COVID vaccine. There just was new guys from Johnson & Johnson about Guillain-Barré syndrome. Guillain-Barré is a ascending paralysis that can occur with vaccines. I have had patients have horrible issues with that relative. I've got one patient in particular I'm aware of that had a problem after a vaccine. It's tragic when it happens. You're 125 times more likely to get Guillain-Barré from COVID than you are from the COVID vaccine at the current time. You're 400 times more likely to form a blood clot from smoking, pregnancy, or obesity than you are from the COVID vaccine. Yet we don't have a handle on all those things. So I say, by and large, if you have an autoimmune disease or process, you absolutely should talk to your physician. But I've yet to find a condition that I've said, oh no, I won't give you that because of that. I'd rather you roll your dice with COVID than the vaccine. I just don't think there are many out there.
So I have a hard time keeping a straight face when people talk about that. I'm not doing the vaccine because it's not FDA approved. And then I look at all the different supplements that they are taking that are not FDA approved.
But I'll
I'm
go to
like,
the co-op and buy cattle warmer, and I'll take
yeah,
it.
yeah. We had a group of folks who were wanting to take some kind of horse medicine, because that was a cheap, effective way to. And I'm like, but you won't do the vaccine, but you're going to take a medicine for horses.
Yep.
So
I think that goes back to the amount of distrust that Americans have for one party of a government. If it was the party you supported, then you probably going to support them more or trust them more. But since it's not the party you support, then
Tribalism.
all of this conspiracy stuff and I can't trust them and blah blah blah.
Yeah, it's tribalism. You got to pick your team, and you got to fight for them no matter what. Yeah, I mean, it's like we've talked about it plenty of times. You make sports out of politics. You pick a sports team, you got to root for them no matter what. There's no thinking involved, and we have a lot of that, unfortunately, in our country, and that doesn't bode well when we need to come together.
You're exactly right, but yet the tribe leaders on at least one of the tribes, in general, like with the vaccine or taking the vaccine, they're just
that's the part that makes even less sense.
They're touting your choice not to take it, but yet they're all vaccinated.
right.
The gentleman that won't allow a mask mandate in Texas was getting tested every day and signed up for the monoclonal antibodies the minute that he got tested positive.
Yeah.
That's where I struggle, and where I have trouble with that is their lack of honesty about it. If it's good enough for them, it should be good enough for those that they represent.
Yeah. Brooke,
So
you shared. Go ahead.
Go ahead. No, go ahead, Stacy. You're good.
Oh, I was going to mention that you shared an article with us the other day, and it's called "Republican Rhetoric versus Reality on Vaccinations," and it's from The Hill, and I'll post it in the show notes. But I found it interesting that it talks about what the government has the authority to do and what it doesn't constitutionally, because it seems like anytime we have an issue like vaccines or anything else really, where the government is going to issue some kind of mandate, then everybody becomes a constitutional lawyer. They know exactly what the Constitution says and what it means and blah, blah, blah. But here it talks about the Public Health Service Act and that the CDC and the Department of Health and Human Services has the authority to prevent the introduction, spread, and transmission of spread from one state to another. And that in general, the federal government has took a step back and gave the authority to the states to control that, to keep the spread from state to state. And then there was some cases in 1905 where the Supreme Court upheld requiring vaccinations for anyone over 21 for smallpox. I mean, that's an example of the government can mandate this, and it's actually constitutional. So and there was a statement here from Justice John Marshall Harlan from 1905, who said, "Liberty secured by the Constitution of the United States to every person within its jurisdiction does not impose an absolute right in each person to be at all times, in all circumstances, wholly free from restraint." And I think that's important to note too. When it comes to public health, there is restrictions and restraints that the government can and should do to keep us healthy, basically, to keep us safe. So I just thought that was
the fact that you threw in a John Marshall Harlan. He's the best Supreme Court justice of all time, the great dissenter. He is
there you go,
my hero.
I just want to point out that he quoted an article that I found.
Yeah, good job.
That's right. That's right.
And that's where I think we get into the issue of kind of our desire to be individually free. And, we talk about our freedoms. And I joking with my wife or anybody else talk about, we turn them into freedoms, FREEDUMBS. We're just so obstinate on the fact that we can't be told what to do. But look at our entire drunk driving and sobriety laws. That's exactly what they are. The drunk driver hardly ever gets hurt in a wreck. They're so relaxed and so cool, so calm that they don't stiffen up or anything else. We set guidance about sobriety and drunk driving to protect the others on the road. And the vaccinations are a similar process. They're meant to protect you, yes, but They're meant to protect the public as a whole and to allow us to continue to have the things that our freedoms that we've had lost exposure to over the last year. But yeah, and it's a great article, and and we're seeing this tete-a-tete now occurring with masking of the school boards, and the school board saying guidance, and the governor saying you can't, and now the lawyer saying that exceeds the governor's authority. He declared it under an emergency. He had to declare there still is a public health emergency to have the right to issue the executive order to not do something to prolong or to stop the emergency, the pandemic. If that's not a conflict of interest, I could do something to end this pandemic, so I can't issue this order, but I'm going to not issue the order. And now you're seeing the federal government come in and saying that may be a civil rights violation. They've told Tennessee this week, I think, actually, that this may be violating civil rights of the others, and we may get on you for that. The Biden administration has now came out to say that if you take Medicaid or Medicare dollars in a nursing facility, they have the right to require your staff to be vaccinated because they're paying for the care of those individuals, and they're right. That can soon come for hospitals also, obviously. 30% of hospitals in this country now require vaccination, but when it's FDA approved, it'll be 90% of them more. So it's this constant battle that we're in now, this kind of tete-a-tete back and forth. But you're right, everybody's an infectious disease and constitutional law expert now.
That's right.
They're also an expert on what HIPAA means, that it's against,
HIPAA violation.
I can't ask you as a caregiver for my child if you've been vaccinated or not because you're violating my HIPAA right or my HIPAA's right. I mean, so that's been a big pet peeve of mine through this ordeal as well. Like, people don't understand what HIPAA is.
Yeah, or how, like you said, individual rights work. Like, okay, maybe you do have the right not to wear a mask, but you certainly don't have a right to tell a business that they can't require a mask too, because it's their private business. You're infringing on their individual liberties by doing that. So
it seems like everybody falls into the trap. Well, I'm saying everybody is a generalization, but where when you proclaim that you care about freedom, individual freedom, what you really mean is the freedom that I like, that pertains to me, not absolute freedom. Like the example I'm thinking of is Pastor Greg Locke, and I don't know if you're familiar with him, Daniel, but yeah. So recently he was on. They did a CNN thing with him. And he basically was saying that he would ban anyone from coming to his church that wore a mask.
I almost went the next Sunday just for fun. I almost rode down there. I wanted to go so bad.
Yeah, he's in Tennessee. He's probably, how close is he to you?
He's
probably
a
2 hours.
3 hours, 3.5 hours.
Okay, yeah. But
I'll go with you. I'm in Tennessee.
Well, so
I'm not far from you.
Shane Claiborne is a Christian activist, mostly immigration and topics like that. But he actually did go to the church and wore a mask. And he was supposed to do an update on Twitter about his experience, and I don't think he's done it yet. But I'm waiting on that because that has to be the most interesting thing ever. But, pretty much like Greg Locke is using his power to limit freedom of people to wearing masks, right? So it's crazy. And I going back to the whole patience thing, I don't have patience for Christians and pastors who act like that. Period. Like that, if you aren't like proclaiming Christ while you're talking about freedom and all this stuff, then I have a little more wiggle room with you. But when you are, and you're using God to back you up in your promotion of freedom being the most sacred thing you could ever think of, and we don't care about public health and all this stuff, I don't have patience for you. Like I have to walk away so I don't punch you.
So that kind of makes me think of a question that I got doing taking a terrible idea and dipping into the comments on, I think it may have been a WCIB article that was talking about.
Don't ever do it.
I know, it was an awful idea. There was a lot of people talking about, it was talking about pastors trying to encourage vaccinations with something in the title. And the comments were people saying things to the effect of, oh, that shouldn't be brought up in church. I only want to hear somebody preaching about, Christ crucified. And I guess this is more of a question, for everybody. How would you respond to that? I feel like this was kind of a good lead into it. It may be part of the answer, but Yeah, how would you respond to somebody that said this shouldn't be, the church should have no business talking about this because we should only be preaching Christ crucified?
I will take that one on.
I figured you'd like that one. So
Yeah, I mean, there's lots of things that we preach that isn't Christ crucified, first of all. But second of all, I get asked my opinion as a pastor on things that I really have no business weighing in on, period, anyway. I mean, people go to the hospital or they see their doctor and then they come to me and want my opinion on it because I'm important in their life, because I'm a pastor, right? So if I am the shepherd of my flock and my people are suffering from a pyramid scheme, right? Like there's somebody going door to door to my parishioners asking them to give them money for a pyramid scheme, I'm probably going to speak out against that because that's harming my folks. Personally, the way I have done this is this: don't take your medical advice from me. I'm no more qualified than anybody else. But my advice to you is don't listen to nurse Twitter or doctor Facebook. Like, go to the doctors and the medical professionals that you have built trust in through the years and talk to them.
yeah.
I mean, that's where I'm going at. That this whole don't check your brain at the door kind of thing, that God gave us a brain and he wants us to use it and talk to people and gain information. But I mean, multiple times in multiple places and in multiple ways, in videos and from the pulpit and in newsletters and in emails and whatever, Aaron and I have encouraged folks, if you can get the vaccine, go do it because you're protecting all of us. We use the personal example of Hudson. I mean, he's still considered a medically fragile child. And people claim to love him and want to do all these things. And they stood the best way right now you can protect my grandson is getting a vaccine, so that you lessen the risk of me becoming infected and me infecting him or you infecting him directly. So no, I don't have a problem with it at all. If pastors can get up and tell you who to vote for in the voting booth, they sure as heck, and they shouldn't, by the way, just let me make that perfectly clear. In my opinion, they should, if you know how your pastor votes, maybe your pastor's doing the wrong thing. But if pastors can weigh in on that, or whether or not we should have a casino or whatever, then they sure as heck should get to weigh in on vaccines or masks for that matter. And that's all I have to say about that.
The evangelical churches, what's our goal as an evangelical church? It should be to reach others for Christ, right?
Absolutely.
So we should be looking for our communities and looking out for those that are disadvantaged or there. Because if they're not there, you don't have them to reach out to. If they die, you don't have an opportunity to win them to Christ. And if you want to be able to go out and, our goal is not just talk about Christ crucified, it's to talk about Christ risen. Mm-hmm. And our purpose to save people in that. If you want to go spread that, we need this pandemic to end. So we can go do that, and we can be free to do that. I agree. It's frustrating, but
I 100% agree with you. I think when you talk about like pastoral advice that you get from somebody, it's almost always like day-to-day advice on how you're going to handle a certain situation.
And we also don't mind churches talking about the sanctity of life at all. We talk about the unborn.
Yep.
What about everyone else's life and their protection?
Yep.
Right. Yeah, there's more to pro-choice than just, or pro-life than just abortion, talking about the unborn. Mm-hmm.
So speaking of that, I actually had a question related, and this is one of the things that you hear people saying, oh, we can't take the vaccine because stem cells was used in the research. Can you talk about that? Was stem cells used in research? Is it often used for vaccines, that type of thing?
So I'm not an expert in this per se, but so the benefit of stem cells are, of course, that they can be reproduced, they can be used for cell lines. And yes, in the 70s or so, there was aborted tissue that was aborted, not for the purpose of medical research. That was not the reason for the abortion, but it was aborted fetal tissue that was taken and germinated. A cell line is germinated from that. It's been used in medical research for decades since. And so, yes, many products that we use in medicine have probably used cells that stem There are now multiple generations from that cell line. There are no fetal products in the vaccine. There are no fetal pieces. No infants at all were harmed recently at all for this. Again, my understanding is there are cells that are used that reproduce from a line that started from tissue that was unfortunately aborted in the 70s. But not for that reason. It wasn't, a child is not taken for that purpose or anything else. Certainly not recently, not at all. But it is the source that they use to just create these things to do a lot of the research with. And it's used in research for multiple things, including cosmetics and other pharmaceuticals and things too. So it's not just the vaccines that you would have an issue with that. Mary Kay and Maybelline and everything else uses those same lines as well for their research. So,
Great, thank you. Clearing that up. All right, Brooke Bowling, do you have any more questions?
I would like to hear your opinion. Washington County, Tennessee School Board today voted that students must wear masks starting on Monday. However, parents can opt out their child. To me, that feels like putting a little Band-Aid on a gaping wound. Thoughts on this opt-out option?
So personally, of course, I have absolutely no tolerance for that. I can't support that. That's coming again from a very difficult place, and from the state government in particular being very prescriptive on the way that they want to see these things go. I mean, the school boards were warned essentially that, if they put these type of mandates in place, they would possibly face a special session where they were going to allow the kids to move from district to district and take their funding with them, essentially threatening the funding of the school districts if they did it. So many of them were hesitant to do so, obviously. Some did act and do so. That was kind of, I say it's a big game of chicken between the politics and the school board. So politicians told them to play chicken and they blinked. Then before the politicians could move, Bill Lee initiated the executive order, said every parent could decide to opt out and do that. Now you have others saying that that's outside of Lee's constitutional authority as governor and that can't be enforced. And some school districts, National and Metro Memphis, have gone back and said, no, we will enforce the mandate. We'll make it part of the dress code. Now you have the legislators starting to come back in special session again to remove the districts and the funding options for the school. So the school board is in a very difficult place. It's a very hard place to be, and I do understand that. The idea of putting a mandate in place in general makes about 15% of the population comply just because the mandate is there. So it's better than nothing, absolutely. If you make it a true opt-out and make them sign something, have something that you can hold obligated to because of that, it's better than nothing, but it's not much better than nothing. And it really needs to be a universal masking policy to be, to be effective. Again, my point I'm going to make to my school board locally here in the next week or so is again, you're picking and choosing what you want to follow. So the CDC recommendations are universal masking. Mm-hmm. The CDC recommendations are also removing a child from school and making them sit out 10 days or until after a negative COVID test. My local school district has no issue sending kids to my office to get COVID tests so they can get back to school quicker. We're about to run out of said COVID tests because there's not a large enough supply. So in the next 2 weeks, if they keep doing this, I won't be able to do any COVID testing on school-age kids or anybody else, and I'll be out for 10 to 12 days. I'm like, so listen, if you want to enforce this part of the CDC policy, you need to enforce this part of the CDC policy to make it all work together.
It needs to be both and instead of either or.
Yes, exactly. It doesn't work real well. So we're certainly trying to advocate and push. I think people are trying to quell the political dissension on both sides by trying to make it this opt-out or this either-or clause, but it's not real effective, unfortunately.
So what advice?
Virginia both have passed universal rules, and Tennessee's the control group in this case.
Yeah. So, and I get where they're coming from. I mean, leading a church, my husband's the lead pastor, but watching this internal fighting about, don't make me wear a mask or I'm never showing my face again, or, I watched tonight, we serve a drive-through community meal, and I watched, there were 4 or 5 of us that got there before, and it was a large enough space that we could have socially distanced and been okay, but we all put our masks on. And as people walked in the door, if they didn't have their mask, they went to their car and got it and just came and put it on. It was a positive peer pressure kind of situation.
Mhm.
Nobody said you must put a mask on,
Right.
In fact, a conversation I had with someone as well, where the rest of us are all masked. It's your choice, mask or not mask.
Mhm.
I mean, that person chose to go ahead and go to their car and get a mask. I've worked with children for many years, and I think the same would happen with the kids.
Right.
You know, and so I just, what is your advice to a parent who's really struggling with this?
I think again, you've got very loud individuals that are saying that we're harming our kids or causing them undue mental stress or whatever else by a mask issue. I don't think that's the case. There's very little research to indicate that whatsoever. As a matter of fact, a group of 35, I think, psychologists or
I read that
physicians
today.
just put out a statement saying that there's no evidence that this is unduly harm on your kid. So I agree. I would just say it's very hard. The one thing I would say is it's very hard for young children to stand out because of peer pressure and those things. And I think in that regard, a universal mask mandate would be very beneficial in that. That's why schools go to adopted school uniforms so the kids don't stand out relative to that. And dress codes and things such as that, which again, we have no issue enforcing the dress codes. We can enforce the masking just fine. I will tell you that, what I do think is, harmful is kids is, my own experience. And I watched my 8 and my 10-year-old go through this. When I was sick, my wife did an incredible job of keeping them pretty isolated from what was going on. They didn't know until after the fact really how sick I really was. They didn't know I was ventilated, for example. We didn't go do FaceTimes and me on the vent and things like that. But they certainly got the gist of how sick I was. My 8 and my 10-year-old will walk around in my house with a mask on at times when just we're home. You talk about scarring. Seeing me go through my COVID experience has scarred them dramatically. And I worry a little bit about what kind of PTSD they're going to have from that. When numbers were down, they went to a birthday event with a Dude Perfect at the Bristol Motor Speedway, and kind of spread out from everybody. My 8-year-old grabbed his mask and put it on. I was like, "Oh my gosh, nobody's wearing a mask!" Like, he's got a complex about it. He puts it on in the car sometimes because it was just that. But there's no harm from him wearing that mask. I'm yet to really see a kid come in and say, "Oh my gosh, I can't breathe" or anything else. It really is not that big a deal. It's a very small price to pay, I think. But I agree, it's easier if there is a universal requirement for it to make people not stand out. But I've told my kids they'll wear a mask, and when we go places, they're in and out. We've been very few indoor places like restaurants and things. We get takeout a lot, but we don't go very often to set things. But if we do, we'll wear a mask. I've worn a mask probably for the entirety of the thing, more so than a lot, in large part because of my PTSD, and the other part because of that very kind of example you said earlier, just be an example. At least in my community, people know who I am, and they see my ballot health mask, and I wear it everywhere I go. Just smile when they get mad at me when I got it on. But it's fine.
Well, I knew that we were in trouble with the Delta variant when on one Sunday at church, there were hardly any masks. The next Sunday, every single medical professional that we had in the congregation had a mask on. And I was like, okay, we need to start paying attention. Yeah, pay attention. So,
all right. Well, Daniel, we've talked for a while, and I really appreciate you coming on again and answering our questions. Do you have any, I guess, final thoughts, final advice, final message for our listeners?
No, I mean, I guess I would just say again, it's a strenuous time. It's difficult in multiple areas and things. I understand that multiple areas are trying to do the best they can, whether that's from restaurants and retail and other things. Everyone seems short-staffed. I'd ask for some patience and some prayers for your hospital staff currently right now. They're certainly overworked and in high stress and dealing with a lot of things that they don't want to deal with. They're frustrated that they can't always supply the attention or that you may feel like you need. So just have patience and grace for them. Pray for them as you can. Pray for our leaders as well, that they will make decisions that are for the good of the public and serve them the way they need to serve and not be motivated politically at all. And I just would ask that we all also try not to not to make this a political issue, but be compassionate about this and actively cross the act towards those variants. when people were averse to Christ's actions, he didn't belittle them or call them out. He brought them alongside and pointed out their sins and told them not to do it anymore and tried to give an example, but he wasn't berating or belittling. So, and I need that as much as anybody sometimes, because there are people that I want to berate or belittle or just get away from. So, just I'd ask for prayer and patience for all as we go through this, and we will come out the other side of this, and we will see another day. And we're blessed, I think, to live in an incredible country that will come out the other side of this as well. But we need compassion and love for each other in the current time, and again, love for society as a whole instead of just loving ourselves.
It's good word.
Amen.
Yeah. So thank you, Daniel, for your advice. Thank you for your medical message, for your work, and thank you for your Christian message. That it is just great to hear medical professionals like yourself who are Christians speaking out and speaking truth. So thank you so much. Peace be to you.
I appreciate it, guys. Nice to see y'all. Nice to meet you, Justin and Brooke. And Justin, we'll see if you change format again after this one. If we totally screw this one up, and we'll be on the third format later. But good to see you guys. Take care.
All right. Peace be to you. Have a good night. Thank you so much for tuning in. We really hope you got some enjoyment out of the podcast this week. Remember to check out our website, www.appalachianliturgy.com, and follow us on all of our social medias. If you want an easy way to support us, though, make sure to subscribe to our channels and like our videos on YouTube. Also, join our email list for updates and let us know how we're doing. See you next week, everyone. Appalachian Liturgy Podcast is a JRS Studios production.